So we met in 2007. It was a great moment because it was the beginning of a collaboration on therapeutic application of ultrasound for cardiology. And we met with Emmanuel first, and then we began to work together on shockwave therapy for cardiology, for cardiac valves. And we had a lot of ideas to work together, especially try to do stiffness mapping of the myocardium. Already in 2007 we were already beginning to think about this. And we began to work on this during more than 10 years, just as research, and then we tried to transfer it to clinics. I think it's a little bit like this.
It's exactly like this, and if I remind well, we even start working also on vascular disease, on the pulse wave velocity with ultrafast imaging, and it was starting to use these diagnosis tools for arterial stiffness, and after we switched from arterial stiffness to myocardial stiffness since 2010, if I am not wrong.
Yes, no, I agree. I think it's really a story of science also, because it was at the beginning it was a basic science project, and we're really curious about how we could apply the ultrafast technology to cardiology and cardiovascular applications. So I remember you came to visit us in the lab.
It was at the time, it was Rue Vauclin.
And after that we started working together with preclinical studies, and I remember you coming with your car, and
my Scenic.
Your Scenic. So we moved the machine, the prototype. At the time it was a big prototype, but we could took it in your car and move it to the
Carpentier Foundation. In the building just close to the Hôpital Européen Georges Pompidou.
So they needed a young founder, so they asked me. I started working with them in 2011 during my PhD, and after my postdoc, I went back and I really worked on the technology, the probe, to really make it work as a prototype. So it was natural that I became a founder of the company too. I think what also brings us together is the fact that we are passionate for science and medical application, and we want to make a difference inside this community and for the patients of Emmanuel. We have a great access to the medical field thanks to Emmanuel, and to the science thanks to the lab. So this interaction makes us very powerful in this sense of trying to bring the science, the basic technology, to the patient bedside.
No, you need physics for medicine. It's exactly that, applying the physics for medicine to improve diagnosis and treatment, and for us in cardiovascular, but I know that are working all field, but for us it's very important because it's new technology, new type of treatment, and based on ultrasound. And when this is based on ultrasound, it's non-invasive, it's safe for the patient, for the diagnosis and for the treatment, and it's outstanding for how the future of cardiology can be based on this new technology. I don't know if you want to speak about that.
Perhaps we can add also that there is a very long-standing history in our school for translation from physics to clinics. In fact, more than 100 years ago, there was Pierre and Marie Curie in the school at ESPCI. They discovered radium. And then from this, they went to do radium bombs, so radiotherapy, just in an hospital built near the school, Institut Curie. So it was already in the DNA of our university more than 100 years ago to transfer just fundamental physics to really devices for radiology or radiotherapy.
And came eMyosound. eMyosound came from a clinical problem. We, up to now, are not able to well evaluate patients with heart failure, and especially patients with preserved ejection fraction heart failure. It's very difficult for us to say you have an heart failure, yes or not, because it's linked to the hypertrophy of the heart, and when you look, the heart is doing well, the contraction is good. So we need tools to improve the diagnosis and the follow-up of the treatment, and this is the basis of eMyosound, and perhaps you can explain how this new technology can help us.
Yeah, so this is absolutely a unique technology. So it's based on the ultrafast imaging and shear wave elastography. So these are technologies that we pioneered in physics for medicine. And when we applied this to cardiology, we realized that there was a lot of application for cardiology. Actually, the stiffness of the myocardium is a key parameter, and this cannot be measured by any other technique. So when we realized that we could measure the stiffness of the heart during one cardiac cycle, we just realized that it was it has a lot of potential.
And did you notice that for Emmanuel, the problem comes from the medical question, and for scientists, it comes from the tools that we have in hand. So making this match is very important to grow the field. It's a discussion between physicians and physicists to really bring something. If one side doesn't understand the other side, it can't work. So we really need to speak the same language, and this is what we've done with Emmanuel. There is a complete match. Now we speak with the same words. We explain the things with the same words. It keeps, of course, the medical specialty, and we are experts in ultrasound, and it will stay like this, but we are able to understand each other, and this is very, very important.
And it took us more than 15 years to understand how we can use this parameter, to validate it on preclinical studies, to develop the technology, and because the technology was not ready 15 years ago to do that. But then we developed all the tools to assess myocardial stiffness, and we started a few years ago clinical studies. We did a proof of concept on human patients, and we are now extending the application to cardiac amyloidosis and heart failure and other cardiomyopathies.
For sure.
Perhaps you can speak a little bit about the Eureka moment. In fact, there were several ones, but I think at least one was really important for us. And we have to come to the technology of eMyosound. In fact, eMyosound is providing a system which is able to remotely palpate tissue. So from outside, you are able to palpate, create a vibration on the myocardium. And then we try to image this vibration. But this vibration is propagating very fast in our myocardium, several meters per second. So we had to image in 3D at ultra-fast frame rate, thousands of images per second. So it was really a big challenge. And I think the best moment was when we first imaged for the first time this vibration propagating in the myocardium at thousands of frames per second. Of course, it was taking a lot of time and calculation at that time, more than 10 years ago. But now it's completely fully automatic, and you've got access to the stiffness in all directions inside the myocardium.
Yeah.
So I remember when we started, there was a good heart for push, for palpation, not good heart. So it was really the beginning. We knew in the lab which volunteers were good volunteers. But now we're happy because the system works on everybody, volunteers, patients, and this is really the step forward that we've done during this past 10 years.
We'd like to emphasize, for us, it's a true breakthrough. It's a revolution for us for evaluating our patient, because now we access to a new parameter that no one was able to do it. So it's really not a new technology coming for a new gadget. It's really something new tools, and it's performance in terms of physics and engineering. But for us, it's a new parameter. And if you look the trend of echo development during the last 50 years, we have seen that each time the technology adapts to the disease and new drugs and new therapeutic. At the beginning, it was all the patient with cardiology was coronary artery disease, myocardial infarction, how to detect myocardial infarction, how to follow those patients. So we developed echo with perfusion, with contrast, with how to see the myocardium that is dead or not dead. So it was a complete development of the echo because of the patient. Now myocardial infarction is not anymore a problem. We went after to valve disease, how to evaluate the valve. Because myocardial was done, but the valve was a big problem. And we don't want to replace the valve, we want to repair the valve. So we have to understand how the valve dysfunctions. So we developed a 3D echo, the transesophageal echo tools by the physicists and engineers to help us to cure the disease in the best way. And now come the myocardium, because now we know that it's the next stage of the heart failure is now the myocardial disease, like hypertrophic cardiomyopathy, amyloidosis, other disease, and it was a time that there was no diagnosis and no treatment. So the physician was not really care about that. Now, since 5 years, we have new drugs, new type of treatment that can save life, but we need tools to diagnose this not new, but this population. And so came the top tissue Doppler, the strain, but all of this, it's only for deformation. It's a consequence of the disease. You don't see the disease itself. You don't realize how the myocardium is sick. Now, with this new technology, the 3D real-time elastography, shear wave, we will be able to analyze the myocardium itself and to follow the disease itself. So it's a complete revolution, thanks to these outstanding physicists and engineers. And from this came eMyosound to develop these new tools, new technology to help our patients.